Hello, everyone. So, Screencast 11.2, this should be relatively short, just about 20 minutes or so. And this is looking at Chapter 10, Epidemiology, Health Policy, and Planning. So, this is kind of an overview chapter, maybe of where public health officials, how they kind of do what they do, try to influence policy, and then where that tension is between epidemiologists and the work that they do, and then what society wants or doesn't want. Here are the key messages of the chapter. If you're interested in taking a look at that, go ahead and pause the recording. Okay, so the full value of epidemiologic research is only realized when it is translated into health policy. So we've got seatbelts, we've got vaccines, examples of things that have changed public health for the better. There's an interesting website, I think it's by Johns Hopkins University, 100 Objects That Shaped Public Health. Some of these things we take for granted. For example, airbags. Airbags obviously haven't always been the case. Going back to the 1940s, inventors started to develop the concept of the airbag. It took 30 years before some of the major manufacturers of cars started to put it in some of their models. As things improved over time, and other safety measures such as seat belts grew in popularity, as well as laws that seat belts needed to be used. The airbag then had its moment. By 1998, all cars and light trucks sold in the US were required to have a driver and passenger side front seat airbag. Big gulp. Don't know how many of you were kids in the 1980s, but the big gulp was the greatest thing of all time. We worship the big gulp, 32 ounces of joy. And it was one of those things that I think our parents did a better job of controlling our behavior back then than parents do now. 32 ounces was a great deal. It seemed like we would get that for 39 cents or 49 cents. It was just the most amazing thing. But obviously, all of that sugar is bad for our teeth, bad for our weight gain, bad for increasing diabetes risk, as well as heart disease. We have an appreciation that sugar contributes to coronary artery disease. The big gulps got in bigger and bigger over time, and there is the expectation when we go to restaurants that we're going to get unlimited refills of soda. So, where does public policy and health epidemiologic research kind of intersect? Well, Michael Bloomberg in 2012 tried to limit the sale of sugary drinks larger than 16 ounces in New York City, and that ultimately failed. Obviously, there are going to be people fighting against things that infringe upon their ability to make sales within restaurants. So, it gets into legislation. What are the laws in an area? Is something constitutional or unconstitutional? But it's all part of the process of trying to reduce the economic burden. So, for example, in Berkeley, California, there was a tax on sugary beverages. Why is that potentially valuable? Similar to a tax on cigarettes. We know that it leads to consequences in health. And so, how can you then fund public health measures to bring awareness or to pay for those individuals who might need health insurance, not health insurance, but need medical coverage in the future? When you look at things like funding Medicaid or Medicare, car seat wasn't always used or taken seriously by people. It was Dr. Susan Baker's epidemiologic research that showed that a lot of children under the age of 13 died by car accidents in 1976 and 77. And again, think about that. No internet, compiling all this data from all over the place. Must have been very laborious work. The highest death rate was in infants, and the second highest death rate was in toddlers. So states followed over time to approve laws to require children to ride in car seats, and we've seen large drops in death rates in infants and those 1 through 3. Interestingly, despite those huge successes, one study found that more than 90% of parents improperly installed their infant's car seat. Let's talk about health policy and health planning. Health policy can be viewed as a set of decisions about strategic goals for the health sector and the means for achieving these goals. Health policy provides a framework for health promoting actions covering the social, economic, and environmental determinants of health. Policy is expressed in norms, practices, regulations, and laws affecting the health of the population, which together provide shape, direction, and consistency to decisions made over time. Health planning, that's the process of identifying key objectives and choosing among alternative means of achieving them. Evaluation is the process of determining, as systematically and objectively as possible, the relevance, effectiveness, efficiency, and impact of activities with respect to agreed goals. The evaluation of specific interventions is well advanced. It is much more difficult and controversial to determine and compare the overall performance of health systems. Public policy is the sum of the decision making that shapes society. It provides a framework for the development of, for example, industrial and agricultural production, corporate management, and health services. It helps to determine the range of options from which organizations and individuals make their choices and thus directly influences the environment and patterns of living. Something we take for granted, garbage trucks. We put things in our recycling bins, we put things in our garbage bins, and trucks come by and pick them up. Versus things getting dumped into sewers, piled in the streets, and having that garbage float down rivers. Or having animals tear into them and making something that is kind of unsightly. I was in Ireland this past summer and we left Dublin early one morning. And to see all the garbage bags on the street, it was really interesting. It was obvious that maybe in that area there was not the use of those bins. And boy, I don't know if you've been to Ireland, but I don't know how garbage trucks could fit through some of those streets. Unleaded gas, definitely a change from the past because of recognition of health consequences being exposed to lead. So, epidemiologic studies can influence health policy or influence public policy. Hopefully, epi research educates and informs us. Hopefully, our elected leaders then lead by utilizing this form of research to make decisions and increase public awareness. Unfortunately, sometimes public opinion is louder, stronger, and noisier. Consider autism and public opinion. Even though epidemiologic studies have discounted and refuted the original Wakefield study, many Americans consider vaccines to be unsafe. And that was apparent when we looked at the measles outbreak that occurred, I think it was in Disneyland in California between December of 2014 and February 2015. So, from the CDC report, you can read there about the number of patients who developed measles and their vaccination status. And it wasn't just children, it was also adults too. People forget the consequences of certain diseases and the ramifications it has on people and their health. I think everybody should have an education as to how we have, we take for granted things in America, probably in Canada too. We take for granted these things. People should be reminded within the education system about where we have been in the past and what got us to where we are now. Almost all policies affect health. Policy decisions by government and non-government agencies have a significant impact on health. For example, agricultural policies influence the availability, price, and quality of meat and dairy products. Advertising and fiscal policies influence the price and availability of cigarettes or healthy foods such as fruit. Transport policies influence the extent of urban air pollution and the risk of traffic crashes. And I honestly can't remember why this slide was in here other than I'm sure that car or that vehicle there isn't going to top out at 50. Now, looking at health policy and practice, the time scale for the application of epidemiological research to policy varies, especially with chronic diseases. It might be measured in decades versus years. Now, box 10.3 in your text outlines the findings of research on coronary heart disease and the resulting policy decisions in the United States. This example illustrates the steps in the evolution of public policy in parallel to the healthcare planning process. If you're interested in reading about it, go ahead and pause the recording. In most countries, little attention has been directed toward long-term community-based prevention programs for heart disease and even less to facilitating healthy dietary habits, physical activity, and discouraging smoking at the population level. However, coronary heart disease is the first major chronic non-communicable disease to receive such close attention from both researchers and policymakers. It is possible that more rapid action will be taken to control other major chronic non-communicable diseases on the basis of the experience gained, as for example with the control of tobacco use. I think one that is definitely freaking out epidemiologists is diabetes. I think projections are from sub-epidemiologic research that 1 in 3 or 1 in 4 people will have diabetes by the year 2050. I think if my memory serves me correctly. What will change things? Well, we do know that American dietary habits and exercise habits do not meet minimum recommendations. Maybe the thing that helps American society is the production of many of these GLP inhibitors, the things like Ozempic and Mounjaro. Maybe those are the things that will help people to change their behavior. Now, for communicable diseases, action has usually been more swift because infectious epidemics are seen as a more immediate national threat and a threat to the economy. For example, looking at SARS, which affected 8,000 people and caused 1,300 deaths, was estimated to cost $30 to $140 billion. Travel and trade were seriously affected by the fear of infection, and costly preventative programs were established in many countries. I know some research is coming out now, and it'll be interesting to learn about the total number of lives lost. I think we have a kind of a general idea on that, and also the economic impact to the botched response for COVID-19. Health planning, these are the stages. First step, assessing the burden. You want to measure the overall health status of the community. Where no info exists, prevalence of major risk factors for disease can be collected. Is there morbidity and mortality associated with the disease? You want to identify that data and the morbidity, which reflects the burden of the illness. So this section here we're talking about is something that the health planners, public health officials would do when looking at how policy could be impactful upon public health. Understand the causes is the second step. Identify the major preventable causes of the disease so that intervention strategies can be developed. It is reassuring that the major causes of death appear to have the same risk factor in most societies. Interventions should have the prevention of disease as their primary focus, but this is not always possible. The third step, we need info to guide decision making on resource allocation and the relationships between health intervention programs and changes in health status. Efficiency is a measure of the relationship between the results achieved and the resources expended, provides the basis for the optimal use of resources, and covers the relationship between costs and effectiveness of an intervention. This is an area that combines epidemiology and health economics. Now, assessing efficiency, again, this is where economics and health collide. There is a cost effectiveness analysis, which is used for assessing efficiency. It seeks to determine the cost and effectiveness of an intervention or its alternatives to determine the relative degree to which they result in the desired health outcome. There's the cost-benefit analysis, which considers the economic costs of a defined type of disease or injury and the costs for prevention. Fifth step involves setting targets and making sure that they can be reached. We need to anticipate and address the problems that are likely to arise as a result of the decisions that have been made. Final step in the planning process is monitoring and measuring progress. Monitoring is the continuous follow-up of activities to ensure that they are proceeding according to plan.